are doing good. Myself, Gina, Quality and Infection Control Manager. Today we will go through infection prevention and control management of NMC Provita managed healthcare facilities. Once we complete the session, you'll be aware about the following: infection control program, chain of infection, type of infection, infection prevention strategies, importance of hand hygiene, standard and transmission-based precautions, clinical waste management, importance of staff health and vaccination program, and at last, spillage management. Infection control department is called part of quality department in our facility. It's led by Director of Quality Jenny Sinclair, myself, Manager of Quality and Infection Control Department. Melvin is the Acting Quality Infection Control Officer. We have Quality Infection Control Coordinators in various locations: George for Abu Dhabi, Jasmine Alain, NMC Royal and Al Sara, Beulah, Nerissa Home Care. Edison is the Document Controller and the Quality Admin Assistant. Jitin is the Medical Records Coordinator for LTCU. And Sheila for Home Care. Infection Control Program. Why do we need an infection control program? To prevent, detect, and control infection. Whose responsibility is infection control? Is it for the infection control team or clinical team? No, it's everyone's responsibility. Infection control is everybody's business. Prevention is always better than cure. Infection control program is a plan of action designed to identify infections that occur in patients and employees that have the potential for disease transmission, identify opportunities for reduction of healthcare-associated infections, and integrate evidence-based guidelines and research into standards of practice. As previously mentioned, it is designed to protect patient, visitors, staff, and carers. In our facility, we have an Infection Prevention and Control Committee, which consists of multidisciplinary team who meet on a monthly basis to decide on the infection control measures that need to be implemented. We conduct education and training for healthcare providers. Outbreak investigation. If in case there is any outbreak of infection, we will be investigating as a team, and we need to report this one to our sector regulatory authority, which is DOH. At present, during the COVID pandemic, we are reporting regularly on a daily basis to DOH. Communicable disease reporting to be done for any patient who is being diagnosed with any communicable disease. But for staff, we advise them to let us know so that we can keep a record of that. But we will not be reporting that to DOH. Antibiotic stewardship program is to minimize the unnecessary use of antibiotic. We cater long-term and home care patients who might have exposed to many organisms and antibiotics, and they may be multi-drug resistant already. By doing a proper antibiotic stewardship program, we are trying to preserve those antibiotics which is susceptible to organisms that can be used for patients when they get ill due to infection. Again, it's a multidisciplinary approach. We monitor the use of antibiotic on a regular basis. Staff health promotion. This consists of vaccination of staff. We provide hepatitis B vaccine and flu vaccine to staff. Other vaccines are not provided, but if in case there is an outbreak or a need we identified, then we will be providing those kind of vaccines. And you play an integral role in infection control program by implementing the measures which we introduce and prevent the spread of infection. Chain of infection. It starts with an infectious agent. It could be a bacteria, virus, or fungi. It grows and multiplies in a reservoir. Certain examples are soil, water, human being, animals, and it comes out of the body through portal of exit, which could be nose, mouth, skin, wound, etc. Once it comes out, it needs a pathway to enter someone else's body. That pathway is called mode of transmission. It could happen through airway. It could happen through air, droplet, contact, or through vectors like mosquito. Then it needs a portal of entry like portal of exit to enter the body. Then, to whom the infection will be affected? It's mostly for susceptible host. Susceptible host is somebody who is susceptible to get infection. Usually it's elderly and pediatric population, but in case of our patients, they are all having less immunity, so they are prone to get infection. In this case, the important element is to break the chain of infection. Thereby, we can prevent spread of infection. There are different kinds of infection, which is categorized into two: healthcare-associated infections and community-acquired infection. From the word itself, we can understand the difference. Healthcare-associated infections are those developed due to healthcare-associated procedures. For example, MRSA, multi-drug resistant Staphylococcus aureus. Community-acquired infection means which is occurring from community. An example for that is TB. Even though I told about MRSA for healthcare-associated infection, at present we could see even community-acquired MRSA as well. As there is a pandemic ongoing in relation to coronavirus, we just thought of thinking about coronavirus as well. In 2020 Jan, WHO declared COVID-19 as a global health emergency, and later they declared it as a pandemic. Coronavirus is a type of virus that causes infection in your sinuses, upper respiratory system, throat and nose. There are many different types of virus, but some are very serious. In early Jan 2020, WHO identified a new type of coronavirus known as novel coronavirus in China. It was first identified in 1960, but scientists had no idea where it came from. Coronavirus got their name, corona, due to their crown-like structure. It can affect both animals and humans. They spread the same way as other cold viruses. They can spread through coughing and sneezing. Can also spread by touching an infected person's face, hand, or other body parts. The virus can also spread by touching infected door knobs, which might have been touched by infected people. The symptoms, if the attack is not severe, can go away within 3 to 5 days. If the infection spread to your lower respiratory tract, it can reach your windpipe and both of your lungs, where it can lead to pneumonia. This is more common in older people with heart issues or people with weak immune system. The virus can spread to your kidneys. It may lead to kidney failure if not diagnosed and properly managed. Tests like nose, throat swab, and blood work can identify the virus. Until now, there is no vaccine is available for coronavirus, but the works are ongoing. To prevent the spread of virus, what are things we could do? After coughing, sneezing, before, during, and after you prepare food, wash your hands. Wash your hands when they are visibly dirty. Keep your hands and fingers away from your mouth, nose, and eyes. Avoid contact with people who are infected or you suspect they might be affected. Avoid close contact with affected individuals, even at home. Do not use used items such as towels, spoons, glass, etc. Cook your meal thoroughly, especially meat, chicken, and eggs. Use different chopping boards and knives for raw meat and other foods. When shopping in wet markets, make sure to wash your hands if you touch a live animal or seafood. Do not touch your nose, eyes, mouth after touching any animal or animal products. If you use any tissue after sneezing, immediately throw that away. If you feel any of the symptoms, make sure you seek medical care and share your previous travel history with your healthcare provider. The most important thing to do is to avoid undercooked animal products at all costs, whether it's milk, meat, or animal organs. Our local regulatory authorities introduce many regulations at present to prevent the spread of corona. In that, one of the important thing is use of mask in public and private areas, social distancing. By following those measures, stay safe and stay protected. Let's move on to the next important element in infection control, which is hand hygiene. That is the most important method of preventing infection. 80% of infectious diseases are transmitted by touch. What you need to know about hand washing? Why should I use soap and water to wash my hands? Germs can get into your hands and items you touch throughout the day. When your hands may be dirty, it's best to wash with soap and water to remove whatever germs and chemicals may be on them. Warm or cold water? Either is fine as long as it is clean. Bar soap or liquid soap? Either is fine. Does the soap have to be antibacterial to work? No, plain soap and water works just as well. But if you have access to antibacterial soap, make use of that. What if I don't have soap but I have access to water? Using soap to hand washing is more effective than using water alone. But if water is all you have, rub your hands together under it and wipe off with a clean towel or air dry. When hands are not visibly dirty, you can use an alcohol-based sanitizer that contains at least 60% alcohol. How long do I need to scrub when washing my hands? Scrubbing your hands for at least 20 seconds is most effective. So for hand sanitizer, do it for 20 seconds, and for hand washing from 40 to 60 seconds. Do I have to clean under my fingernails? Yes, germs like to hide under fingernails. Make sure to clean there too. Towel or air dry? Either is fine, but if you are using a towel, make sure it is clean. Should I use paper towel to turn off the faucet or open the door of a public bathroom? There isn't much scientific evidence about this. If you're concerned about getting germs on your hands, after you wash them, you can use a paper towel to turn off the faucet or open door handles. But at present, it's always better to use a tissue. What if I don't have soap or water to wash my hands? If soap and water are not available, use an alcohol-based hand sanitizer that contains at least 60% alcohol. Alcohol-based hand sanitizers can quickly kill most types of germs on the hands, but may not kill certain bacteria and viruses that cause diarrhea. You should wash your hands before eating or after using restroom. It's a study on efficacy of novel alcohol-based hand rub products. Remember, protect yourself and others by washing your hands with soap and water. Steps in hand washing. You're familiar with this one, so we are not going through one by one. But you need to follow all these steps to ensure that the hands are clean. Let's do a self-assessment on hand hygiene. Hand hygiene refers to hand washing using skin cleanser, decontaminating with alcohol hand rub, decontaminating with 4% cohexidine, all of the above. Answer is all of the above. Hand hygiene should be performed before having contact with patient, moving from contaminated to clean body side, after removing gloves, before and after using restroom. Select the best answer. Answer is all the above. If the hands are not visibly dirty, which of the following regimen to be used? Soap and water, alcohol hand rub. As it is not visibly dirty, we can go for alcohol hand rub. If it is visibly dirty, soap and water. How pathogens most frequently spread from one patient to another patient? Contaminated equipment, airborne spread through cough, contaminated hands, poor environmental maintenance. Select the best answer. Actually, through all, pathogens can spread, but the most frequent one is contaminated hands. And at present, even through cough. Clostridium difficile is readily killed by alcohol hand rub. True or false? False. As Clostridium difficile is spore-forming microorganism, alcohol hand rub will not be effective against it. Soap and water is the preferable solution for hand hygiene. Duration of hand hygiene with hand rub: 5 seconds, 5 minutes, 20 to 30 seconds, 40 to 60 seconds. Answer is C, 20 to 30 seconds. Healthcare workers pose a greater infection risk if they wear rings on their fingers, wear the same pair of gloves for different patients, wear artificial nails, and all of the above. Answer is all of the above. Standard precautions. This applies to all patients receiving care in facility regardless of their diagnosis or presumed infectious status. It consists of hand hygiene, use of PPE, linen management, that means the linen used for patients, equipment, which include even sharing of equipment, occupational health, the vaccination will come. Personal protective equipment refers to protective clothing, gloves, face shield, goggles, face mask, or respirators or other equipment designed to protect the wearer from injury or the spread of infection or illness. Its effective use of PPE includes properly removing and disposing of contaminated PPE to prevent exposing both the wearer and other people from infection. These are the types of PPE which is available. Factors influencing PPE selection. Types of exposure anticipated. We need to see what is the kind of exposure we are anticipating. What is the category of isolation precaution? Durability and appropriateness for the task. And fitness. What is the truth behind this? Whether we need to keep the green color outside or white color outside. As per the studies, it's saying that there is no specific difference. It doesn't matter if you are wearing the mask because you are sick and don't want to spread your germs, or wearing it to prevent yourself being infected. The function of the blue or green layer is to prevent germs from sticking to it. If you wear the mask the other way, the moisture from the air will stick onto it, making it easier for germs to stay there. Advice on the use of mask is in the context of COVID-19. This is the latest interim guideline from WHO on the use of mask on various occasions. General advice. Wearing a medical mask is one of the prevention measures to limit spread of certain respiratory diseases, including coronavirus. However, the use of mask alone is insufficient to provide adequate level of protection, and other equally relevant measures should be adopted. For individuals without respiratory symptoms, a medical mask is not required, as no evidence is available on its usefulness to protect non-sick person. But At present, due to this pandemic, everyone are supposed to wear mask when they are in a public space, not in their family. Individuals with respiratory syndrome obviously need to wear a mask and seek medical care if they are experiencing any respiratory symptoms. This is the type of N95 mask which is available in our facility. Donning of PPE. During consultation, we need to keep hands away from face, limit surfaces touched, changed when torn or heavily contaminated, work from clean to dry. So this is the sequence of wearing PPE. Gown, face mask, respirator, goggles, gloves. Doffing, that means removal of PPE. Again, we need to consider these factors. Remove all PPE before exiting the patient room. Perform hand hygiene between steps if hands become contaminated and immediately after removing PPE. Gloves, start with gloves, goggles, gown, mask. Special precautions. As we mentioned previously about the mode of transmission, these are the special precautions which is there in a healthcare facility. Contact precaution, droplet precaution, airborne. In case of contact, we used to advise the staff to wear gown and gloves always. And based on the procedure, you need to think logically regarding the use of PPE. Droplet means a surgical mask need to be worn by staff. But if, for example, if we need to take a patient for an appointment outside our facility, then the patient is supposed to wear a surgical mask. The patient who is on droplet precaution is supposed to wear a surgical mask outside the room. Airborne precaution where N95 mask to be used. But in our facility, we don't have facility of providing negative pressure room. So usually we are not giving airborne precaution in our facility. If in case any patient need airborne precaution, we are transferring them to those facilities where there is negative pressure room. Waste management. You might have seen already all these color-coded bags in the clinical area. Black is for domestic waste, means foodstuff. Yellow is for biohazard waste, that means whichever coming in contact with the blood and body fluids. Biohazard waste is for infectious waste, that means even though it's blood and body fluid, it may not be infectious. But if a patient is having hepatitis B positive, then we should use always red color bag. Sharp container is to dispose sharps. The same we are following in LTCU and home care. In home care, clinical and hazardous waste shall be disposed in yellow bags on a foot-operated bin with cover. It shall be transported to the office through a leak-proof seal box which is available in every car compartment. It should not be more than 65% full and tied securely. Medical waste logbook to be maintained. The date and time the waste collected, type of waste, quantity of the waste, name and signature. Sharp objects shall be placed in heavy-duty thick polyethylene plastic boxes of yellow color. This is also available in home care, but we are trying to use small one as we will not be having a lot of sharp waste. But it should be kept securely, because in a home means there is chance of kids playing. So we need to ensure that the sharp container is kept safely, securely in a corner. Replacement of the sharp boxes shall be after every 3 months or if already reached up to 75% full. Sharp sticker. There should be a sticker attached to the sharp container mentioning date open, date expiry, patient number, staff ID and sign. Sharp box shall be placed in yellow bag after closure and mention date of closure, time and patient number and staff initial with markup before transporting. So usually the waste will be transported Waste means medical waste and sharp boxes will be transported using the help of our drivers. Even we do recycling in our long-term care facility for paper, plastic, cans, and glass. Facility consideration: use of antiseptics and disinfectants. Cleaning schedule: we have cleaning schedule for each area. Temperature control: our water temperature is controlled. Construction activities: where there is a construction activity or a renovation, we are completing a form called ATWA and ICRA. ICRA is Infection Control Risk Assessment. ATWA is the authorization to work permit. So this need to be authorized by the department who is bringing the activity, infection control team, occupational health and safety before starting the activity. We are doing water monitoring twice a year, air monitoring once a year. We do have pest control schedules. On a monthly basis, pest control is ongoing in LCU. Ventilation systems, which include the planned preventive maintenance, PPM of air conditions, is ongoing every 3 months and every 6 months. Food. We don't have our own cafeteria. We get food from outside facility. But we have pantries available in the facility to ensure that staff can go there and have their food. Prevention of nail stick injury. It's an important topic. General guidelines for that include dispose of sharps at source. Sharp bin should be available. No recapping of needle is accepted. Safe field during procedure. So when we plan to do a procedure, ensure that there is safe field. ANTT trays are available in each villa. Make use of that so that you can arrange your supplies. Needleless devices to be used. Once you had any sharp injury, ensure that you follow the post-exposure prophylaxis protocol. Intelex. It's an incident reporting system which you will come to know later in the quality management system presentation. So if there is any incident, you need to report it through the Intelex. In case of home care, keep sharp container near to procedure area when the procedure is ongoing. Dispose of sharps as soon as possible. Do not use defective or broken sharp boxes. Do not rush. Do each procedure at a time. Metal tweezers shall be utilized to remove the needle if necessary. Never prepare sharp ahead of time. Why? Because the next person may not be knowing that sharp is being used by somebody or not. And there is high chance of sharp injury. Management of nail stick injury. First of all, we need to ensure that we clean the site under running water. Never use the area. Inform your line manager regarding the incident. Then do incident reporting to Intelex. Then your line manager will advise you to consult the emergency doctor within 24 hours. Submit medical report with lab results to Infection Control and OHS. Conduct lab investigations for patient after getting informed consent. We used to conduct hepatitis B, hepatitis C and HIV tests for the patient if there is any nail stick injury. But in that case, we need to get an informed consent done before taking blood for these tests from the patient. The explanation shall be done by the doctors. Vaccination program. As previously I mentioned, we are providing hepatitis B vaccine to healthcare workers, hepatitis A for food handlers. Influenza, it's an optional vaccine, but it will be available for healthcare workers and all staff during winter season in UAE. Varicella if needed if we see that there is any outbreak. Cover your cough to ensure the spread of infection. So, as much as possible, let's try not to cough or sneeze on our hands. If in case it happened also, make sure that suddenly you are washing your hands. Spill kit. A spill kit is a collection of items to be used in case of a spill, leak or other discharge of oil or any blood and body fluid. Spill kits are developed so that a prompt response and cleanup may be performed. In case of home care, we are not providing any spill kit, but you can use the disinfectant which is available at home, which includes sodium hypochlorite. But in case of long term, in each villa, we have provided with spill kit. When to use blood and body fluid spill kit? If there is a spill of blood, vomitus, urine, fecal matter. There are two types of spill kits. One is for blood and body fluids, another one is for chemicals. So in case of chemicals, these are the indications for use of spill kit. Usually in our case, we are not using any high concentration of acids, alkalis, bases or something in our facility. That is why usually we are not using, but still we are keeping chemical spill kit if in case there is any spill of disinfectant. How to use? These are the instructions to use the spill kit, but this will be done by the housekeeping department. We need to notify the housekeeping department immediately and place the hazard warning sign. Then once the housekeeping department is aware about the spill, they will make necessary arrangement according to the steps which is mentioned here. So PPEs are provided. We need to ensure that good ventilation is there. There is HUSTAB granules and tablets.